Hello everyone and welcome to this new vlog of our series on simplifying health economics. And today I'm going to run this vlog on costs with Misael. Misael has recently joined the MIDAS team, is an health economist and is from Lancaster University. Hello Misael.
Hello, hi everybody.
So we talk about cost today, and costs usually have a negative perception attached to them. So when we think about costs, we think about payments, expenditures, but we need to really go a bit more deeper in terms of understanding what lies behind costs, and that's what we're trying to do today. And first of all, Misael will talk through about the microeconomics of costs. So what economic theory says about cost and prices. And then I will talk a bit more about health economic evaluations, and then we'll talk about specific concepts around cost in health economic evaluation. And now I'm going to leave the stage to Misael.
Okay, thank you. So we will explore two perspectives here. So the first one is cost within a firm. It's not an extensive examination of the cost within a firm, but we will explore total cost, variable cost, and then cost as fixed in the market. So because every product is sold in the market and the price is also an indication of the cost. So we can see, for example, here an example of fixed cost, variable cost, and total cost. Fixed cost is basically a cost that is not changing with a product. For example, rent is kind of a fixed cost because every month we need to pay the rent, even if we produce one output, no output, or 10 outputs. So rent is a fixed cost. And in variable cost, we can have, for example, some inputs, some insumes, or working hours, or in a hospital setting, for example, we can have medicines, for example, which varies according to the unit that people is treated. Total cost is actually just a sum of both. And the average cost is the total cost divided by the quantity that is produced. Up to here, everything is pretty straightforward. And what could be a bit new here is the concept of marginal cost. The marginal cost is the cost of the additional product that is incurred. For example, in this simple example, for the first quantity unit, the total cost is 170, and for producing 2 units is 210. So the difference is 40, and this is the marginal cost, and so. So total cost is fixed cost plus variable cost, and as you see here, this is really a textbook example, a very classical example and easy to understand.
So Misael, looking at the table, actually, looking at the marginal cost especially, there is a point beyond which it doesn't seem so convenient to produce more, isn't it? And that's often the case.
Yes. For example, from unit 1 to unit 2, this is decreasing. From unit 2 and 3 also is also decreasing. So, but after that, the cost is increasing. So there is a theory here. For example, apart from that, do we need to produce more? So this will depend on what will happen in the market, of the position of the firm in the market. The theory says that the marginal cost is related to the supply curve, which is a technical term to say that as higher is the price, the firm would like to produce more. So, but this is beyond this scope. But there is a sense that first, our cost is very high. We can imagine that, for example, let's say that we have that 1 unit of let's say hospital facility costs 1 million per year, okay? If we produce only 1 unit, then that will be 1 million per unit, sorry. Then if we produce 2, then that cost will be 500,000 per unit. So in that sense, the first bit, the cost is decreasing.
Yeah.
The cost is decreasing up to it achieves the economies of scale, which is more or less the efficient way that the firm is running. But after that, the cost will be increasing again. Why is this? Because if the unit is a full capacity, so producing more, we need to pay extra hours, for example, and extra hours are more expensive. Or we need to overwork the unit, and that could be expensive. So that is the concept. So the first bit, the costs are decreasing, and then after we achieve efficiency, the cost is also increasing again.
Of course, yeah. And you might need to buy another unit, and then you incur another substantial cost and stuff like that. Yeah.
Okay, let's see this another perspective. This is really intuitive. Here we have the concept of inputs and outputs. Okay, so for example, in this example, we do in bread, producing bread, we have wheat as an input, and as output, we have flour. Okay, but this flour is an input for another industry. Okay, in this industry is producing bread. So now this output flour will be an input in this new industry. So what will happen is that each good and service will be sold in a market. So with a basic theory of demand and supply that everybody learns in basic by basic knowledge. So we can say that every product is sold in a market, and every product has their own price defined in the market. Now, the cost will be equal to this price in the market. For example, if we are a small firm, we cannot impact in the price, in the demand, so we need to take the price which is in the market. So when we say, okay, let's make a budget for our industry, then we go to the market and ask, okay, what input one is selling in the market at that price, input two is selling to the market at that price, and so on. Which means that at the end we are taking the prices that is fixed in the market as our cost for our industry. So this is this kind of another insight that we can give.
Thank you, Misael. Now, Misael has covered the theory behind the costs and setting prices, and the importance of understanding the market for inputs. Let's try to translate all this into health, and specifically health economic evaluations, where typically we have two or more alternatives we are trying to compare in terms of costs and consequences. And of course, today we are going to focus more on the cost side. Now, when we are talking about costs in health economic evaluations, we typically think about two components. So one is the resource use, which is expressed in natural units, and this is very important to remember. So we are not talking about monetary units yet. Resource use will then be multiplied by unit costs, which are expressed in monetary units, to obtain total costs. Now, I'm going to talk a bit more about resource use in the next few seconds, and then Misael will cover unit costs later on. But as I was saying before, resource use is expressed in natural units. So we need to think about how much use we make of a certain resource. And that can be applied to everything we do in our everyday lives. You know, if we need to organize a party, if we need to organize a dinner, if we need, for example, to build a shed in our garden, we need some resources, which might be place, timber, and so on. And all these will be associated with number. We need, for example, 5 plates, 6 glasses, and so on. And this is what I mean with natural units. In the same way, in healthcare, we are going to probably thinking about the minutes we spend with a GP, which could be 10, 15 minutes, the number of tablets we take of a specific medication a day, could be 1 tablet, 2 tablets, and so on. So again, 1, 2, 10 minutes, 50 minutes, everything is expressed in natural unit. Now, let's have a look at what type of costs we typically consider in health economic evaluations. Typically, we have direct medical costs. Direct medical costs are really those that are strictly linked to the provision of healthcare. Here, you can see a few examples, for example, generic care, medication, and consultation. And for each of these, again, it's important we think in natural units. So, for example, X number of medication, X minutes with the GPs, X number of treatment or procedure, and so on. Then we can also consider direct non-medical costs, which are broadly linked to the provision of healthcare. So some examples here, like travel, accommodation, food, home modification. So not really strictly healthcare related, but broadly linked to the provision of healthcare. So how long it will take for patients to travel to hospital, for example, or to appointments, if caregivers might need some form of accommodation while the patient has been admitted to a hospital, and so on. And then another macro category of cost is that related to indirect costs. And here we kind of come out from the health or social care realm, and we're thinking about personal costs for the patients, lost income for themselves, but also for their families or for caregivers as a consequence of having a particular disease or condition. Also as a consequence of being admitted to hospitals or being treated for a particular disease or condition. Also more societal costs, for example, productivity losses. In the UK, as a minimum, we need to consider the healthcare system perspective. And of course, when we talk about healthcare system perspective, we talk about direct medical costs and possibly some form of direct non-medical cost.
Which doesn't mean that those are not important, isn't it?
Because no, exactly. And that is often the case. The indirect costs are the most substantial, but also the most difficult to capture, because you can really think about a lot of spillover effects on other types of industry which come from a particular patient being treated. Now, I just want to show you this slide because I think it's important to understand that typically costs are right skewed. So what do I mean with that? There are, if you take, for example, under 100 patients and you follow them up for 6 months in terms of how many GP appointments they had, how many medication they take, and how many times they've been admitted to hospital and so on, you will see that some of them have used a lot of resources. So if you think about the horizontal axis, for example, the number of GP appointments or the number of medications they had in a 6-month period, you will see that some of them have used a lot of them, but the majority of patients have used none or just a few resources in that specific time period. And that is often the case. And that's why we say and we define cost as a right skewed distribution.
Okay, let's see the unit cost. As a summary, the unit cost is a total expenditure to produce 1 unit of particular service, as it was explained here. And then there is a direct cost, which is that the inputs, the insumes that are directly related to the service, usually, for example, labor and medicines, and the indirect cost and also the opportunity cost that are related to this kind of productivity loss that we are speaking about. On the here we have some resources for data and unit costs, the nature reference cost. Those costs are really well defined. So they have a history of doing this. They are applying theory, economic theory, and a lot of specialist knowledge. So if we can have a practical input how to use this cost. You just need to link to search for this or to click in the link which will be available. Here's our example, for example, in this social care adult service. We have here the first salary. Okay, the salary is this is defined by year, 37,000 per year, for example. And then the salary on cost, which is kind of indirect cost. This is a national national insurance contribution.
Mm-hmm.
Then we have the training and so on, the ongoing training. And then we have these overheads. Yeah, this is the indirect cost, okay? The indirect overheads, the capital endowment. So all of that are related to the administrative services that people require in order to provide, to employ these people doing their work. So receptionists, the states, rent, and so on. Just an example of the direct cost, how this is estimated. So we have here the total cost that is the sum of what we explained before, including the states and so on. And then we estimate the working days per year. This is a standard one. So this is the number of days without any weekends and holidays. And then we divide this by 7.4, which is the working hours per year. So it's 1,600 a day. Then we divide 85,000 between 1,608, and we got the cost per hour. This is 53. You can see at the bottom of this slide, this is 53 is the cost per hour of this.
And this is really important. Now, focusing on salaries. So yeah, we got the salary for the social worker here, but how do these salaries get established, basically? How does the market work in terms of setting up these salaries?
In this slide, we have the equilibrium in the market, in the labor market. So we have the demand curve and the supply curve. The supply curve is related to the number of physicians and the number of nurses in the market. So this is how many hours are they willing to work to each level of salary.
Mm-hmm.
And the demand curve is related to the systems, the hospitals demanding wanting to contract these physicians or nurses on the market. So the higher the price, they are willing to hire less people. Okay. And how this can change, how the equilibrium can change. That was your question. So one example, for example, is the demand can change if people are retiring, for example, there are less forces. The supply side can be reduced because of people are retiring, or people are going abroad to work because their force are demanded in overseas territories, and they just to travel, and then the supply is reduced. Right? If this happens, then the new equilibrium will be a higher salary. And another example of increasing salaries, for example, is unions.
Mm-hmm.
Physicians or nurse unions negotiating with the government for a higher pay. So this is another example of how these salaries could be seen affected in the market. But in any case, we are price takers. So we are not influencing the level of salaries that is in the market. So we take these salaries that is agreed in the market, and from that we estimate our unit cost.
Oh, that's very clear. No, thank you, Misael. And I think that concludes very well today's vlog around cost. And we hope that you got maybe a better and more positive view about cost and why they are so necessary in healthcare, but also in other industries. So If you have any questions about this vlog or the series, please do get in touch with us. And I just want to thank Misael again for running this vlog with me today. And we'll see you soon for newer vlogs on health economics. See you soon.
Thank you very much.